Swine flu is all the news. More deaths reported in Mexico. Numbers of cases of what appear to be the disease are in the U.S. Other nations beginning to say they see it. How big is the question? Every year at flu time, we ask, how can it be that 36,000 Americans die of ordinary flu and its complications? That's what the Centers for Disease Control says. In a regular flu season of 5 months, that would be 1,500 a week. Yet there are no such screaming headlines about those deaths. Now we're being bombarded with headlines of much smaller levels about 1 week in Mexico. Here in New Mexico, health officials say they've got a plan in place just in case the swine flu heads this way. Dr. Chad Smelzer is with the State Health Department.
The plan is to continue our surveillance. We do surveillance for influenza throughout the entire year around the state of New Mexico, essentially a statewide system. What we've done in this case, because of the outbreak occurring in Mexico and the cases in surrounding states, is we're doing what's called enhanced surveillance. And what that really means is that we're talking to all those places and assuring they know the protocols for how to handle suspect cases or patients that may have this disease, to make it safe for others in the medical facilities, as well as to identify the cases as quickly as possible. We're also working with our colleagues from the state of Chihuahua in Mexico to continue our surveillance there. We do cross-border, binational, really tri-state with Chihuahua, Texas, and New Mexico surveillance for influenza currently.
News reports are a bit sketchy right now, but we understand that the federal government is doing informal surveillance at border crossings, airports, and so forth. How would an informal surveillance operation work?
I'm not familiar with what the federal government is doing informally. I do know that we have been in contact with the Division of Global Migration and Quarantine and the quarantine station that is in El Paso, Texas, discussing how to look for cases that are crossing by land. And the CDC has also put out, in I believe the State Department, some travel advisories.
We understand that this particular flu is targeting, or at least affecting the cases so far, people who generally are not that susceptible to flu, people who have good immune systems, younger people, people 20 to, say, age 40.
This is a new virus. It has never been found in pigs or other animals or humans before. And so anytime you have a new or novel virus, there isn't much immunity in the population, making many different types of people, essentially all people, potentially susceptible.
Is there anything for Americans to be worried about, New Mexicans particularly, right on the border with Mexico?
Well, I think we need to have an appropriate level of concern, and that means we do not need to be in a panic. We need to do diligent work to try to identify if cases are coming into New Mexico, as well as if we have some currently. We need to identify those and isolate them appropriately and make sure they get the appropriate treatment as indicated. I think what people need to do is familiarize themselves with influenza in general and how they can take personal precautions to prevent infection. And those are essentially good personal hygiene, lots of hand washing, try to avoid being around sick individuals. If you're sick yourself, you need to cover your cough so that you don't spread germs, and try to stay out of the public settings as much as possible.
We've had 100 or so deaths in Mexico. The cases are now showing up in Europe. There have been a few cases in the U.S. But in a normal flu season with regular kinds of flu, the CDC says there are as many as 36,000 deaths each year from the flu. Do the numbers make sense to you at this point? Here we've got a couple of hundred, maybe 1,000 cases, but for a regular flu season, if you do the math on a 6-month flu period, if that's what the flu season is, that would be 1,500 deaths in the U.S. a year. Is there a correlation between the level of concern over this and the level of concern over a regular flu season?
regular flu seasons and the number that you quoted, 36,000 deaths, it actually, there's a range from that to up to 50,000 deaths a year, depending on the severity of the seasonal influenza strain that circulates, has been collected over multiple years, and so you then can extrapolate. This particular virus, it's the first time we're seeing it, and so we have limited data. The other thing is we're dependent upon the surveillance in Mexico, and we're dependent on the surveillance in other foreign countries as well as other states around us to gather as much data as we can in order to come to some conclusions.
But my point is that in a regular season, we would have had 1,500, and the new number you mentioned, 50,000 deaths, we would have had more than 1,500 a week in the United States. That's a large number, and shouldn't we be more concerned about that than the swine flu?
I think we need to be concerned about both, the regular influenza that occurs each year as well as novel strains. And we don't want, in this case, a novel strain to add to a seasonal influenza total in terms of mortality.
Dr. Chad Smelzer with the State Health Department.